Hello, everybody. Welcome to High School OT and our High School OT webinar presented by Bojangles. I'm Nick Stevens, High School OT Managing Editor, and today we're talking about the physical and mental health concerns for student athletes during COVID-19. And we've got two doctors here with us. Dr. Josh Bloom is on the top of your screen there next to me that you see. He is with the Carolina Family Practice and Sports Medicine, a member of the NCHSAA Sports Medicine Advisory Committee, and he's been the team physician for USA Baseball and the Carolina Hurricanes. And at the bottom of your screen, you see Dr. Bradley Hack of Carolina Strategies. Easy for me to say. He's a sports psychologist, director of sports psychology for the athletic department at UNC, and has also worked with college and pro athletes from the NFL, NBA, NHL, MLB. The list goes on and on and on there. We appreciate both of you guys joining us here today. I think we've got some really important topics to talk about in terms of health, both physical and mental, for high school student athletes during the pandemic. And I think the first thing I want to just bring up is, what are some of the issues that you guys have seen or the concerns you've seen in your practices with high school athletes as it involves COVID-19 and all the different things that have happened around COVID-19 in the last few months? Dr. Bloom, we'll start with you at the top, and then we'll move down to Dr. Hack.
You know, I think that we've seen a lot of different issues with these student athletes in terms of as related to COVID. I mean, certainly you see some anxiety about, particularly initially, about the disease itself. You know, am I going to contract it? You know, what happens if I get it? What about my family members? But we've also seen a lot of mental health issues, you know, regarding not being able to participate in their sports, not having kind of the things that they're passionate about, such as, you know, football or whatever their sport is, and not having that opportunity. And with that, we've seen we've seen depression, we've seen anxiety, we've seen, you know, a lot of despair. You've seen some maladaptive behaviors, substance abuse, and those kind of things. And I really think that, you know, this pandemic, you know, you have this balance between the risk of participating and potentially modest increased risk of COVID and the consequences of not having that opportunity. And those consequences are very severe. We see them, you know, almost every day in the student athletes that we see in our clinic. And so, yeah, I mean, we've seen it. It's been a real problem. But I think that the mental health issues are really pressing amongst these kids, particularly when they don't have a real light at the end of the tunnel. They don't have a real idea of, you know, when they'll be able to get back and what it's going to look like when they're able to finally get back on the field or on the court.
Dr. Hack, obviously, as a sports psychologist, you deal with many of these mental health issues on a daily basis. What have you seen in your practice from these high school athletes over the last several months?
Well, it's been interesting, Nick. It has kind of evolved, like Dr. Bloom was saying. So initially when we saw the kids, they were pretty frustrated that the seasons had ended and they didn't get a chance to compete for championships. And sad about that as well. But over time, it's evolved much more into feeling very, very down. I think it's just really taken a toll on them. And, you know, they're feeling sad because there's a ton of loss, and we're all facing the losses, the loss of jobs, the loss of loved ones who have contracted it, the loss of time with teammates and with coaches, the loss of time to develop their skills. And so it's just weighing them down, and they're just really sick of it, basically. That's what I'm hearing. And it's leading into a lot of apathy and then boredom as well. It just feels like Groundhog Day, just kind of the same day over and over and over again. And they practice or they train on their own, and they can't get together with their teammates. And it just goes on ad infinitum, and they just don't know when it's going to end, just like, you know, we don't know when it's going to end. So I think the sadness and then just feeling down leads into the boredom and the apathy. And then the other part, Dr. Bloom was mentioning also then, excuse me, is a lot of anxiety, just because there is uncertainty. I'm seeing a little bit more of this with the older athletes that are getting closer to wanting to go to college and getting recruited. And so a lot of the recruitment has been interrupted or halted for a number of sports. And so there's huge question marks. They're saying, you know, I've spent my whole life training so I could go play in college, and now I don't even know if I can do that. I don't know when I can send tapes or when they can come see me play. And so they're feeling a lot of anxiety about that as well. And then the last thing that we're hearing a lot about is just, I can't be me, right? So as athletes, we're vigorous, we're physical. We get out there and we mix it up. We like to challenge ourselves. And there's just not a whole lot of opportunity to do that right now unless they're doing it on their own. A few sports have started up, which is, I think, helpful. So the kids are getting some relief if they're starting to practice or compete a little bit. But up until that point, they're just feeling kind of lost because an essential part of who they are is just they can't engage that every day.
How tied together are the issues of physical and mental health? Do they impact one another?
Absolutely. It's I like to call it a super highway between the mind and the body and the mind. So what happens in our body goes up and we think about it, we feel about it, and what happens in our mind absolutely gets played out in our bodies. And so we like to talk about striving for mental fitness in addition to physical fitness. It's just not something we talk a lot about as a society. It's historically been very, very taboo to talk about mental health. I think using the phrase mental fitness is a good one because you can be mentally healthy, which means you have an absence of any kind of significant depression or anxiety. But you may not be mentally fit. You may not be aware of how you're thinking, what your stress level is, how your body's reacting to the stressors in your life. And you may not be taking care of yourself proactively in a psychological way. We're used to doing it physically, right? We exercise, we eat healthy, we get good rest, we hydrate. These are all the things that athletes learn. But we really need to do the same thing mentally, and it helps to prepare us to handle adversity a little bit better.
Dr. Bloom, are you seeing kids who have anxiety or depression or other issues that they're dealing with? Does it impact them physically when they come into your office? Do you see them there?
Yeah, and absolutely. We certainly see that impact. And as Dr. Hack said, the exercise is a well-studied and extremely effective intervention for depression, for anxiety, for a variety of mental health and mental wellness and mental fitness components. So certainly we see that. I think that it's on multiple levels that we're seeing with these student athletes. So not only are they not able to compete and have the uncertainty about, when things are going to end, they also lose their structure. A lot the identity, their calendar on the year after year is based on, hey, my season starts this, my off season is this time of year. If I do X, Y, and Z, I'm going to be prepared to compete in this time. And all of that just got blown up. And you take and that really, candidly, I've just seen a lot of despair in these kids. And as they've gotten to do more, in terms of, having an outlet. And I think that we're seeing that in student athletes, whether it's organized, official or not, they're now out and about, and that's been helpful. But again, those things that they've learned from years and years of, hey, this is how you get from A to B, and these this is the path you take. To take that away is pretty devastating to kids. And I think that candidly, that part of things and the consequences of that has been ignored to some extent, or at least not emphasized enough. And, I think that it needs to be folks like us, Dr. Hack, myself, folks like you, who need to advocate for these kids and understand that if we're going to prioritize kids, athletes, student athletes, young people, we need to give them an opportunity to get back and do what they do, albeit, with appropriate precautions, but that's really, really important for their kind of overall health and well-being. It's hard to draw the line between physical and mental, but their overall health and well-being, it's critical to have those opportunities, in my opinion.
Well, and I think, for people who are watching who likely don't know, it's important to point out both of you have high school age student athletes, right?
Yes.
So what you're talking about impacts your own family. So it's not somebody just saying these things that doesn't impact them. But that's a good segue to what I was going to ask next. When we do see these sports resuming, and there's a varied amount of activity going on across the state right now. If you're in a private school, you might be competing today. If you're in a public school, you're waiting until at least November, depending on which sport you're in. And then some districts have been doing workouts since June. Others are still suspended today. Does resuming that activity, even if it's just going to workouts, does resuming that activity solve or help solve some of these issues that you guys are seeing in your practices?
I think it's a big piece of the puzzle because, like Josh was saying, it's getting back to their identities and who they are. And I've heard just a lot of relief from the kids that have been able to go back and start practicing, or maybe we've had a tournament on the weekends here and there. So it's not just getting back together and being with their teammates. That's a big part of it, and feeling like they're with their family again and they're with their mates and their bros. But it's also seeing, how have my skills developed or deteriorated? So facing competition has been really important for a lot of the athletes that we work with, and being able to assess themselves and where they stand. And that's a lot of times it's a source of good feelings about themselves. It's a source of confidence. It gives them something to strive for. So I do think it's a piece. I think the social part is really, really important as well. A lot of the athletes that I work with are trying to stay connected through Zoom with their teammates, but it's very difficult. You just miss little things when you're having in-person interactions. And high school kids really are working on developing their social skills so that then when they go off into the adult world, they know how to handle themselves. And for a lot of athletes, they have to sacrifice friendships with other people because they're spending so much time in their sport. Right. So their team becomes a major source of those social interactions and that social practice. And so getting back is going to help them with that kind of development as well. I don't think it's going to fix everything. Obviously, there are huge issues going on in our country right now, and there's lots of other things that kids might be experiencing with their families, individual difficulties that they're having. But I think it definitely is a piece that is helping them to start to feel a little bit better.
I agree.
I'm sorry.
I'm sorry. I would agree wholeheartedly. I think it's a big part of the solution, right? It does not solve it entirely, but just having that opportunity to get together with your teammates, to have some leadership and direction from their coaches, from their mentors, to have that discipline in place about, what they're working for, and then just the joy of running around with their buddies and potentially competing, because certainly a lot of these kids are out competing in, again, maybe not in high school sanctioned athletics, but in a variety of capacities. And that's the most normal part of their life. And I think providing that is a huge part of the solution.
And the other thing that it offers, to get back to something Dr. Bloom was talking about, was the structure, right? And so everything has changed now. And the kids who are high school athletes that play club sports are used to just hyper structure in their day. I don't know how they do it all. It's crazy. But they're very, very used to it, and it's a challenge. Every day it's a challenge to get everything done. So they learn really good time management skills. They learn how to be efficient and effective, all of which are going to help them as adults, right? And so going back to practice and having that structure gives them that daily challenge, which helps them to then also build their confidence. And then it feels familiar as well. And so that's a big part of it. And they've just felt very lost with what to do with their day. And you would think that they'd be even more productive because they don't have all these practices. They can go train on their own. But because it's such a different situation and they're lacking that structure, they've really struggled and they're just kind of floating around not knowing what to do. So I think that's a big part of it as well.
I just want to mention before I move on to the next topic, for people who are watching, if you have questions of your own, you can tweet them with the hashtag HSOT webinar or comment on Twitter and Facebook live streams that are going on right now. We'll get to those questions at the end of this. Now, Dr. Hack, you have some slides that you put together for some of this, but one of the things I wanted us to touch on was the Wisconsin study that came out earlier this summer, where they interviewed a bunch of high school athletes in the state of Wisconsin, over 3,200 of them, and they found some pretty concerning results, I think. Do you want to walk through some of what was found in that study?
Yeah, just real quick. I think the thing that jumps out at you is the number of high school kids that met criteria to be diagnosed with a mental health disorder. And I think that number was right around 68%. So you're talking about diagnosable depression and diagnosable anxiety through the self-report from the kids, who a lot of times will diminish their symptoms. They don't generally accentuate them. That's stunning. If we had any other sort of health issue where 2/3 of the kids are struggling with a significant disorder, we'd be marching in the streets. There's another study that was with NCAA collegiate athletes, which found that there was also a high percentage of depression and anxiety, not quite to the level that the Wisconsin study found. But they also asked, how many of you are seeking help? So counseling, treatment, anything like that. And it was like 2% for men and 3% for the female athletes. And so this goes back to what I was saying before, as far as the stigma about getting help for this. It's really a shame because kids are struggling and they're suffering. Dr. Bloom hears it in his office every day. I hear it in my office. It doesn't really surprise me all that much that the numbers were that high. It's very concerning now.
You and I were talking earlier, and I mean, it shocked me when I read this that they were estimating 66,000 high school aged athletes in Wisconsin were at risk of developing depression or anxiety due to the pandemic, and that was in May. So we've been through this for a lot longer now since May, and that study also found that physical activity dropped by 50% by those student athletes. And Dr. Bloom, does that just demonstrate that correlation between the two, again, between physical activity and mental health?
Absolutely. I think it does underscore that correlation. And I also think it as Dr. Hack pointed out, there is a loss of control for these student athletes. And there's this kind of feeling that this whole thing is completely unfair. And they didn't cause this, and they don't have a way out of it. And I think really candidly now, so there was that initially, and everyone was in the same boat. And now many states are participating, playing sports, and in independent schools. And so you have that is also layered in to the public school athletes. So wait a minute, why can this happen elsewhere and we still can't? And so I think that it just makes the whole situation very tough. And again, I'm not surprised by those numbers. Some of the things that I've seen in my office, just for my primary care patients or athletes that I take care of, or even children of friends and colleagues, that what's going on with their kids, text messages they're receiving, those kind of things that the kids will tell you. I mean, it's really, it's awful. There is a tremendous amount of despair in student athletes. And again, to me, the most important thing is providing some hope and some clarity. And that is the responsibility of the adults. And really, it is time to prioritize these kids as student athlete and provide, safe opportunity for them to get back. And it can be done. I mean, it's been proven elsewhere. So I think that it is very hard to quantify. I mean, certainly the Wisconsin study quantifies some of the mental health issues. But the risk of, what's going to happen if we return to sports and, COVID rates in the community and so forth. And hey, it's pretty easy to quantify COVID cases, but it's hard to quantify, all the damage that's being done by not participating, kind of death by 1,000 cuts, so to speak, all of that. But it's really significant. And, I don't think it can be overstated, candidly. I think that, we need to work hard to provide opportunities for our kids, they will certainly understand that, that it's not going to look exactly like it once did, but to just have the opportunity to get out, to get together, to have their coaches, to have their mentors, to have their friends around them is really important.
I think the loss of the light at the end of the tunnel, I think that's what Dr. Bloom was talking about. There needs to be the adults kind of saying, here's when we can go back. Here's what you can expect. I think they've been trying to be troopers about it. Well, everybody's in the same boat. I'm just going to keep going and keep going. But eventually we've gotten to, once we get to August to September, they're like, well, what is the point? Why am I training if I'm never going to have a season? I don't know we're going to have any games. And that's why I think you see the dip in the exercise numbers in terms of getting out and doing anything. They're just kind of giving up because they don't feel like they've got anything to look forward to. There's nothing that is certain. So I'm hearing a lot of, well, what's the point of training? And so if they don't see the point to it, sometimes there's no motivation to go do it.
The NFHS, they've done a series, which for those who don't know, the NFHS is the national governing body for high school sports, of which the NCHSAA is a member. Their executive director, Dr. Carissa Niehoff, has had several press conferences over the course of the last few months. And in every one, they talk about the mental health impact that they're hearing this is having on high school athletes around the country. And they actually shared this Wisconsin study a while back. That's where I had first seen it. Dr. Bloom, you're part of the NCHSAA Sports Med Advisory Committee. How big of a topic is the mental health side of things when you guys are talking and in those meetings?
It's a huge part of it. I mean, I think it's part of the whole, we've been in relatively constant contact looking at, how do you get people back? And I would say that, the High School Athletic Association desperately wants to get sports going again. There are some constraints in this state and in various areas that are different, and there's different challenges all over. And this is not an easy topic at all. But I think that group who are medical providers, so they're physicians, and the vast majority of that sports med advisory committee are physicians and athletic trainers. They really recognize the importance of getting back and really pushing to facilitate a return, in a logical and reasonable and sane way from a medical perspective. So I think that, again, you look at the whole package, risks and benefits, but I would say that group has for a long time been pushing, understanding that we really need to provide an opportunity as soon as possible for student athletes to get back on. But get back to competing and training as a group and so forth.
Obviously, high school OT, we're focused on student athletes, but there's a lot of high school students who may not be athletes or who may be involved in other extracurricular activities, band or, the arts, performing arts, or maybe some sort of other club. They're also impacted by all this. Do you guys hear anything about those kids who it might not be sports that have been, taken away or suspended, but it might be something else, or it just could be not going to school and seeing their friends and teachers and all that?
Yeah, I mean, I have an example in my house. My daughter is very much into the performing arts and in the drama club at school and participates in the plays. And, they've been very creative, and they've gone ahead and done some virtual musicals and virtual plays to try to make up for that. But it's the same thing, and then if you just talk with regular students, again, I mean, they're not able to be with their mates, with their buddies and their friends. And that's essentially a very human activity. And we're not able to really be the kinds of humans that we're used to being. And it sounds very basic, but we are social creatures. And so when you take that away, it really affects everybody. So whether you're an athlete or whether you're an actress, or whether you're a musician, I don't think it really matters. It's all kind of the same, and it's really just a shame. And they're in the predicament, as Dr. Bloom said, through no fault of their own, and they're trying to cope with it the best they can. They really are, but they're not sure what to do sometimes, and that's where adults come into play.
Do these issues that we see, is there a potential long-term issue that could develop here because of what's happening today?
I think so. I mean, I worry about, kind of this COVID generation, and, what does this look like when we finally get through this? But I think that, unfortunately, there are going to be some lasting effects. I mean, certainly there are those experiences that these kids missed out on and opportunities. But I also think just having to go through such a traumatic time, and tremendously traumatic for young people, there will be some lasting sequelae and long-term effects from that. And hopefully, we as, medical community, healthcare community, as well as just community in general can recognize that and help kind of lead the way out of that as we get through this. So I worry about it. Dr. Hack probably can speak to that a little bit more eloquently than I can, but I certainly am worried about some potential ramifications down the road from this.
Yeah, I mean, you can look at it many different ways. It's a traumatic experience in many ways for the teenagers that are going through this. Again, a lot of them are trying to cope, but it's been very difficult. In sort of typical sports psychology fashion, though, I'm going to flip it around a little bit and try to look for the silver linings here, because I actually do think that there are a few. So while I think it will have a lasting impact on our kids and they'll remember it, and it'll probably feel a little bit like a scar or a loss that just kind of stings when they think about it down the road. The flip side of that is, and what I've heard from some of the athletes is, it's actually been a nice respite and a nice break from their crazy hectic schedule. And so they've been actually able to recuperate quite a bit. And some of them have actually used the time to rediscover their why. Why am I playing? What is my passion? Why am I going out and doing this every day? Sometimes that gets lost with the day after day after day of practice and rushing here and rushing there. And I think time at home for many, and time with their families and their parents has really been a blessing. where they've been able to kind of reconnect. I joke with some of my friends. I say, it feels like we're back in the 70s, where we only had 1 or 2 practices a day for an hour or a week, and that was it. And the rest of the time, we're just hanging with our neighborhood friends and with our family. So that's one silver lining, I think. And then the other one, too, is it is practice for dealing with adversity. Right now, this is a load of adversity. There's no doubt about it, like we've never seen in our lifetimes. But it's a challenge, and athletes are used to challenging themselves. And that's part of what gives them confidence. Every time you bring courage to face a challenge, you put a little chip in the confidence bin. It's kind of like, all right, I faced that down. Good for me. And so this is very much in a similar vein. And I think if they can think more proactively about coping every day and very deliberately and intentionally with what's going on, I think it provides an opportunity to grow themselves in the way they think about themselves and build some confidence that they can handle tough stuff in life.
And Dr. Hack was on our podcast that we were doing at the beginning of the pandemic, talking about a lot of these very issues. And at the time, you said that student athletes or athletes in general may be more well equipped to handle these types of situations just because of how they go through sports. Can you speak to that just briefly a little bit? What types of tools athletes have that people who might not be in a sports world may not possess?
Yeah, absolutely. So we like to call it the flexible athlete mindset. So in general, psychological health, we're generally psychologically more healthy when we can think flexibly about the world. So it helps us to come up with creative solutions to problems. So athletes face this every day that they go to practice. They don't necessarily know what the practice is going to consist of. Or even conditioning. They don't know what the strength and conditioning coach has mapped out for them. So they're walking into a very uncertain situation, and they find a way within minutes to adapt to that, make sure they can draw upon all of their mental and physical skills and abilities and give it everything that they've got. And they get chances to repeat this over and over and over again. And it's the same thing in competition. You don't really know what the defense is going to throw at you or what the offense is going to throw at you. So you have to be able to recognize it quickly and adapt to it in a very flexible way. And a lot of times athletes are trained in life skills that they don't realize they're trained in. That's a big part of what we do when we talk to athletes is, well, what are some of the things that you've learned through your sport? And this is one of them. And they just don't realize it necessarily. And so because they get so many repetitions, I think in some ways they might be better positioned than non-athletes to be able to deal with this.
We spent a lot of time talking about how not playing sports may be causing some stress, anxiety, depression. But I think there's another issue where kids may be worried about coming back to sports in the middle of a pandemic. Have you guys heard from any kids with that concern or families with that concern? And how would you suggest tackling that issue?
I've heard some of that. I think I've heard more of the opposite in terms of just an eagerness to return. I think that you combat that with some education about what the virus is, what it isn't, and what practices and steps you can take to prevent getting infected or transmitting an infection. And what real risk factors are. And I think that there's a lot of misinformation certainly about COVID-19. But the more you can educate your student athletes about here's what you can do to protect yourself, to protect your teammates, to protect your family, and here's why we think it's safe for you to go back. And I think we are certainly not in the beginning anymore. We have a wealth of data on that. We're learning more all the time. We have the experience of other organizations, professional sports and college sports in other states. Many of it is very informative and educational, and a lot of it is fairly reassuring. And so I think that a lot of it has to do with education. And and I really think a lot of it comes down to good leadership, which is, even to speak to your point earlier about what are some potential positives that come out of the resiliency and that has a lot to do with how coaches have handled this. And I think there's been a lot of coaches who've done a tremendous job of keeping in touch with their players in one way, shape, or form to kind of help shepherd them through this time. And I think that they'll be able to do that to shepherd them into the next step until they actually get back in facilities and start to compete.
Yeah, and I've heard very similar things from the high school athletes that I talk to. The difference is I'm hearing something a little bit different from the collegiate athletes. So like the kids at UNC or the other university kids that we work with, there's a little bit more fear and trepidation from the folks that I've talked to. How is this going to affect me if I contract it down the road? Is it going to affect my lung capacity? Will it affect my heart? Is this going to curtail my professional career? And they're exposed to all different kinds of sources of information. So they're hearing a lot of different things, and they're getting kind of worried. And I've had a few of them say, like, what are we doing here? Should we even be here? The flip side of that is a lot of them want to be there because they've got to showcase their talents so they can go to the next level and get drafted. So it's a real catch-22 for them. I haven't heard it as much from the high school kids, though. They're definitely much more lockstep. We want to get back to playing. We miss
it. There are a lot of schools and school districts that are allowing things to take place. Again, there are still several who are suspended and are doing nothing, and a lot of stuff in between across the state right now. What should parents and coaches be looking for in student athletes, in students, as signs of problems with their mental health, whether it be anxiety or depression, or another issue that might happen? And I know, Dr. Hack, you have a slide for this. I'll pop it up and let you start with this question, and then we'll go to Dr. Bloom.
Well, I'm going to actually backtrack because in order to be able to get some of the data to look out for these things, parents have to be able to create a safe harbor for their kids to come talk to them. And teenagers are tough because as parents, you want to find out what's going on for them. You probably inquire, and it's very normal for them not to want to share. It's part of growing into an adult and kind of being in charge of your own stuff. Sometimes they do that too much, though, and they hold things back. So what I would first emphasize is for parents to make sure that they are really trying to create a bridge with their teenager to have these conversations in a very open way, in a non-judgmental way, and to do a lot of asking and not a whole lot of telling. So being a little bit more Socratic about it. And the coaches who have access, the coaches who are watching who have access to their players, I would absolutely do the same thing, because we don't know if they're going to get that from their parents at home or not. You're an extremely important adult in their lives. So modeling that and saying, hey, it's okay for us to talk about it is the beginning of it. It's also part of the solution. But in order to find out what's going on with the teenagers, you got to be able to ask, and they've got to feel safe in telling the adult what's going on. What I typically will hear from teenagers is either mom and dad don't get it, or they don't listen to me, or they'll try to talk me out of my feelings, right? And the reason that parents generally do that is because when they hear their kid struggling, it feels bad to them. Like it hurts them inside. So they want to fix it by trying to tell the kid the solution, but that doesn't work. It tends to backfire. The kid just feels like they're not being heard. And so what they have to do is really kind of suspend that urge to fix the problem and make sure that they're erring on the side of really, really listening and trying to understand their experience and what it is that they're going through. And oftentimes you don't even have to say anything. And that's the biggest feedback that we get from the kids that we talk to is, God, it's really nice to have a place to talk about this stuff. And not feel like I'm judged or being told what to do. So that would be step number one. But let's get to the slide now. So things to look out for. A lot of this is stuff we've already talked about, but typically sadness more so than you would typically see. And with sadness, you might see a withdrawal. So kids spending even more time in their room, apathy, withdrawal from activities, less talking, less sharing. Kind of going into a cocoon. That can be the beginnings of depression. So kind of keep an eye out for that. There's a difference between sadness in this situation, which is very normal. We don't want to pathologize sadness. But if you start to see withdrawal in other ways, it's really just not your kid, then that's a little bit of a red flag. Irritability, teenagers tend to express depressive feelings or sad feelings in terms of anger. So a lot of times it won't come out as sadness. This is especially true with boys. They're just going to be pissed off all the time. And you're going to be wondering, well, why are they pissed off? And really they're not. They're sad, but they don't either have the words or don't feel safe saying, I feel sad. So it comes out as this anger, this irritability. And then distractibility and worry. So now we're talking more about anxiety. So if you're worrying all the time about what's going to happen and your mind is in the future a lot, you're very distracted from what's going on in the present. So if they seem really out of touch or kind of like they're spacing out, it might be because their mind is full of worry. especially if they're not sharing that with you. And then the changes in behavior, Dr. Bloom mentioned this too. A lot of times if kids are feeling like there's really no point to training or to studying and they're not seeing a light at the end of the tunnel, they're like, well, what the heck? I'm going to try some stuff I've never tried before. So that's when you're talking about sex, drugs, and rock and roll. So kind of keeping an eye out for those kinds of things that tell you that my kid just isn't kind of being my kid right now. That's when you start to ask those questions.
Let me remove that slide so we can see each other again. What do you suggest that parents and coaches look out for when you talk to them in your practice, Dr. Bloom?
Dr. Hack really covered it pretty well. It's a lot of the same things, but I think, a lot of it is, as Dr. Hack said, listening, paying attention, and being there to support them, recognizing that, this is a tough situation for everybody. I think, and this is a tough situation for parents, either in their professional lives or a variety of capacities, financial, those kind of things. So parents tend to get caught up in their own world. And I think it's just really important to make sure that they're paying attention to their kids. And again, looking for those things. But I think to me, it's mostly, as Dr. Hack said, it's kind of a gut that, hey, my kid is just not themselves. Depression is when you practice for a long time, you walk in a room, you know somebody's depressed. The air is sucked out of the room, and you can have that feeling with your own kid, like there's something wrong with my kid, that they're just not themselves. And I think when you have that feeling, if that's your gut feeling as a parent, as a coach, like this something's not right, then you need to stop and acknowledge that and and pay attention to that and try and help out.
So when do you know when someone needs to go get professional help? How do you know the difference between, I'm feeling kind of down today, a little stressed out today, or I have depression or anxiety and I need help?
Well, it's kind of the, I don't know if you remember the old Fram oil filter commercial. You can change your oil filter now, and pay a few bucks, or you can change it later, and then you got to get a whole engine overhaul, right? And it's a little bit similar. It's the same thing with physical health. Dr. Bloom will tell you that for sure. If you stay in front of the wave, you're not going to get swamped over by it. So what I would say is I wouldn't ever let it get to that point as far as having a clinical disorder. I mean, a lot of times we think about mental health in that way, where there's got to be something broken in order to go talk to somebody to fix it. I would say that's kind of the last thing you want to do. You want to get in front of it if at all possible. So the minute you start getting a hint that there's something going on with your kid, I would definitely get an opinion from somebody to find out what they think, and if it's something that's developing that's more serious, or if just a few meetings or talks with whomever, whatever trusted adult they have, might do the trick and keep them from kind of tilting over the edge into it becoming a full-blown depressive disorder or anxiety disorder. And so I would say, you got to trust your spidey senses, right? When they start tingling, you got to be like, let's get out in front of this. Let's call somebody that might understand these things a little bit more and make sure that it doesn't get to that point.
And what about kids or even their parents who may think there's a stigma attached to getting help for mental illness or problems with their mental health?
There is, unfortunately. I mean, it's gotten better throughout my career. It was much worse when I first started. And that's another silver lining, actually. I mean, I'm seeing every day on, USA Today headlines, and, whatever periodical you're reading, it's, mental health this, mental health that, athletes, dealing with mental health issues. So yes, while it's very disturbing that people are struggling this much, it's definitely in the public eye now, which it really needs to be. So that is a bit of a silver lining to all of the problems that are going on. But what I would say, and the way that we approach it here, I mean, it's easier for us because we are dealing with sport issues and we're dealing with athletes a lot. I'm a former coach myself, so we just have a coaching mentality. And so the way we come at this is, let's just kind of analyze your game. Let's see what's going on from a psychological perspective and see if there's any tweaks we can make just to help things go better. And so when you talk about things like just talking with someone to get a consultation or talking with someone about mental fitness, it tends to destigmatize the whole process. And again, if you do this as a matter of course when something pops up and not when it's completely broken, the message gets sent, well, this is something we need to pay attention to. the more adults that ask kids about this, the less it's going to feel stigmatizing.
Dr. Bloom, I want to talk about some of the physical health aspects of this, and we'll come back if people watching have questions for Dr. Hack or Dr. Bloom. You can write them in on the video on Twitter or Facebook, or tweet them with the hashtag HSOT webinar, and we'll get to those at the end for as many as we have time for. But we mentioned earlier, Dr. Bloom, you're a member of the NCHSAA SMAC, Sportsman Advisory Committee. For parents who might still be concerned about the safety of putting their kid out there in a contact sport where they don't have masks on, how confident can you help their confidence level in knowing that the protocols in place are mitigating the risk that's involved in playing sports right now?
Yeah, I think that there's a couple things that are important, several things that are important. First and foremost, this is a respiratory virus. So despite, lots of information or misinformation out there, it's a respiratory virus primarily transmitted by usual viral manner. So, aerosolized particles, and then from direct contact, with what we call fomite. So, if you're sick or you have COVID and you touch your mouth and, then you touch a doorknob and someone touches that doorknob a couple minutes later and then touches their eye, that's how you get it. So kids and, young people can understand that and learn how to protect themselves and protect others. So hand washing practices, appropriate utilization of masks, those things are actually extremely effective, and that's been effective all over the world in terms of the return to sport. And again, recognizing that there's a certain amount of responsibility. What I tell my kids in my house is, you need to operate under the assumption that you are an asymptomatic positive or a pre-symptomatic positive, and that everybody you come in contact with is the same way. So keep your distance, be smart, wash your hands, recognize those kind of things. I think it's also really important to understand that young people, that population that we're talking about, student athletes, are at extremely low risk of serious sequelae from COVID. They're not zero risk, right? Nobody gets a free pass, but their risk is quite low. So not to say, hey, just let them go get it. We're not saying that. We're saying if they did, their risk of having a complicated course of this is extremely low. And that is reassuring. I think that, so those are things. And the other thing is to recognize that a lot of these procedures that have been put in place have been shown to be effective in a variety of settings. So initially, we learned some of this stuff from, sports leagues that were opening overseas, particularly in Asia and then in Europe. And then we've had our own experience. I was very involved with the National Hockey League and obviously a lot more resources, but we learned a lot from that. And a lot of those procedures there were simple, common sense, hand washing, face coverings, making sure that you're not congregating in big groups. And they were able to pull off the end of their season very successfully, as has the NBA and Major League Baseball, and now and college sports teams. Now, they're not without hiccup, right? There are potential hiccups, but again, you address those, and people are honest about if they have symptoms, and you have some protocols in place in terms of temperature checks and those kind of things. And that allows you to potentially identify people early and, and then remove them from those situations. So I think it is a challenge, and it's not going to be perfect, but I think we have plenty of data at this point that says a safe return to sport is a very reasonable and doable thing at this level in high school and middle school kids.
The one thing you just said is a great lead into another issue I wanted to bring up. You talked about the honesty in reporting symptoms. Obviously, you've done a lot with concussions, and kids sometimes will hide concussion symptoms because they want to finish the game, or they're worried about getting a scholarship. What level of concern is there about kids? And I would like to think coaches wouldn't be part of this, but people trying to hide those symptoms in order to win the next game or make the playoffs or whatever it might be.
Yeah, I mean, I think that's a concern, but I think that comes down to the culture of the team and the culture of the organization. We've certainly seen this in the professional leagues. When the culture is certainly set by the leaders on that team, the coaches, the leaders on the team, and say, hey, this is how we're going to do things, and we're going to do the right way, and we're going to be honest. And when that culture is strong and said, hey, you're your brother's keeper. You got to take care of yourself, but you also got to take care of your teammate and the guy you're competing against. You have some integrity and respect. But I think that those kind of things can be taught. And again, that to me, that's leadership, and that's where the coaches come in, and I expect them to do a really good job, and they have in a variety of capacities. So certainly people can hide symptoms or deny symptoms, but I think that hasn't been a huge issue in the other states that I've been in touch with, and as well as some of the other organizations.
One more question about the virus specifically. I think we all know that kids are less susceptible to severe illness because of COVID-19, but there are going to be some coaches and officials and people around who might not be low risk. They might have underlying health issues, or their age may be make them high risk. Are there things that they should be doing? Should they not participate in activities as coaches and officials or fans or whatever? Or do you think it's relatively safe if they follow the protocols that are in place?
I think that's a very individualized question. I think there are certain people who should not be out there. And age is a huge risk factor. So, the older you are, in general, the higher your risk is, and certain other well-defined risk factors. So I think there are certain folks where the risk benefit of being involved or being in, probably, you want to err on the side of caution. That said, certainly, it's an individual choice. You want people to be well informed. You want to have protocols in place so that coaches and officials and other adults who might be at higher risk would be protected, even if there are, even if there is a potential exposure. And that really comes down to, so those folks, should they choose to be out there, need to be particularly careful. And again, I really think the approach of everybody I come in contact with is a potential asymptomatic or pre-symptomatic positive. And if you think like that, then you just move a little bit differently around people, and you space yourself a little bit more, and those kind of things. And that, I think, is a very effective kind of way to go about this. I guess that's probably where I'd live. It's a very individual thing. And there probably are some folks who, it might not be a bad idea for them to, not go back at this point. But again, that's going to be, on an individual basis, those decisions need to be made.
I got a couple other things I want to tackle here that are COVID related, but not specific to the virus. And I think some of this might include some mental aspects too. So Dr. Hack, jump in at any point here if you have something to add. But I've heard from some coaches who have asked. They saw we were doing this webinar and they sent me DMs on Twitter and asked me to ask this question. Are there concerns about kids coming back into rigorous activity after potentially sitting on their butts for several months or not doing a lot of really rigorous work during the pandemic? Is that a health concern that kids need to be aware of? And are there things that we should be doing, coaches, kids, athletic trainers, to help prevent anything from happening?
100%. That is a legitimate concern, right? So kind of coming from the couch to competition is a great way to get hurt. So those are musculoskeletal injuries, first and foremost, strains, sprains, fractures, those kind of things. But even from a concussion perspective, body control, all of those things play a role. So the better shape you're in, the better you're conditioned, the less likely you're going to have injury. So how do you prevent that? Make sure you're going now, right? I would encourage, the districts who have not yet adopted allowing their athletes back. I think, as soon as you can, get them back, because that is going to be helpful for preventing those injuries. Yeah, certainly there's the risk of COVID, but there's all the other things that we see in terms of sports medicine injuries that are going to happen once we start competing again. So the biggest thing is to start working now, and that's your best means to prevent it.
Yeah, and there's two psychological aspects to that as well. The first is, it's pretty well documented that the higher the level of stress the athlete's experiencing, the more susceptible they are to injury. So not only getting their body ready to go, but also getting their mind ready to go. And that's where mental fitness comes into play, and having some skills that they can do to get sharp again and make sure they can manage their stress and their physiological arousal while they're playing. So that's the first piece. The second piece is, Can you imagine sitting on the sofa for 6 months? You go back for a week and then you tear your ACL and you're out for another 9 months. I mean, that would be catastrophic, right? And so they would be like, "Are you kidding me? I can't believe this just happened." So that's another reason to follow the advice of Dr. Bloom and make sure that they start their training way in advance, and also even some free play with their friends to start to get loosened up as well.
One other thing I would say along those lines, so it's not just the exercise, but it's getting back in good sleep pattern, making sure you're taking care of your nutrition, doing all of those things that kind of that overall wellness that will keep you healthier on the field as well.
There's also going to be a pretty big overlap in seasons. Does that create concerns about overuse injuries at all?
Certainly there's, I think once seasons get going, they're going to come fast and furious. And I think there's a certain number of kids, and, even I hear this in my own house, who want to kind of get every little bit they can, right? So I'm going to become a 3-sport athlete instead of a 2-sport athlete because I missed out on some stuff. I'm going to try out for basketball, those kind of things. And that, so I think that is a concern. Hopefully coaches will work together and make sure that, they're working to mitigate the load on those athletes. We talk a lot in sports medicine about load management, and that essentially means what your workload is as an athlete. And so people are going to need to be cognizant of that. But certainly overuse injuries are going to be a concern. I guess, I think for a lot of these folks that, they want to have the opportunity to get out there. So maybe that's a chance you'll take. But I also think that some of those things that we've looked at from the High School Athletic Association to try and mitigate that in terms of those overlap, it's the inherent challenge of this compressed season that we have going forward.
Well, I'm going to leave my questions there. We do have some questions that have come in that I think are pretty good and worthy of getting some answers. We got about 5 minutes left because I promised I wouldn't go longer than 60 minutes. I was aiming for 45. So hopefully we can get through these really quickly here. Dr. Hack, we'll start with you on this one. How can I help prepare my child in the event that sports are canceled or suspended again?
I hope they don't have to. It's tricky because to some degree you want to encourage them to treat the preseason, getting back into shape, and take it seriously as if the season's going to happen. And then if it doesn't, it can feel like, Mom, Dad, you were kind of leading me down the path that this was going to happen. And so it's kind of a tough line and a tough balancing act, really, for the parent. And so I think if you have that open kind of discussion with your kid and you say, look, we're going to move forward with the training for a couple of reasons. One, it's good for you. 2, you get to be kind of who you are naturally, which is a vigorous athlete. 3, it's going to help your mental and your physical functioning. But we're going to also go into it understanding that, we don't have control over what's going to happen as far as whether we're going to have a season or not. But we are going to control the things that are within our realm of control. And that's going to be the things that Dr. Bloom had mentioned with sleep and eating healthy and hydration, as well as preparation. And so I think that this is a good message, actually, again, for life. You don't know what's going to happen. We really don't. We like to plan and make things very structured and predict how our lives are going to go. But man, life just doesn't work that way. And so I would just have an open discussion about all the things that could happen and why it's important to move forward anyway.
Dr. Bloom, I'll let you take this one. Comes assume from it is a parent. My child plays both football and lacrosse. Is it safe for him to play both when they overlap for at least a month?
Yeah, again, I think that that you want to be smart about that. There's been some discussion about both are contact sports. And I'm a concussion guy, so we want to minimize the amount of contact to the head, and so those are the challenges with those two sports in particular, lacrosse and football, right? Both contact sports. I think you can mitigate that to some degree by coaches communicating, by how coaches practice. Certainly, limiting your contact in practice. I would expect that to be the case in football and lacrosse. And then you got to be aware of situations. So I think it's very different if you're a lacrosse goalie and you're not having as much contact, and then you could play a game on Wednesday and then Friday, or Monday, Wednesday, Friday, that kind of thing. So the short answer is, I think in this situation, if that's your child's passion, they love both of them and they want to participate in both of them, then I would not tell them not to. I would say that there needs to be a lot of communication between the coaching staffs, and you might need to sacrifice a little bit here and there from one sport or the other to make sure that your student athlete stays healthy. But I do think it's doable.
There's another similar question here. It says, I'm a concerned mom of a football player. I'm always worried he's going to get hurt anyway. Now he's going to play 2 seasons in 1 year. How can this be safe?
By 2 seasons in 1 year, I'm assuming that you're talking about we're going to play football from February until April or May, and then turn around and play again in August. So we did take that into consideration, and again, so there's a few things that I think that are helpful. Number one, North Carolina has the most progressive rules in the country in terms of contact in football and practice. And the majority of contact for high school athletes does happen in practice. And that is going to be largely gone away. So the amount of games in this spring season are going to be shortened. And then there will be a period of time that prior to going into the August, if we're starting on time next year. So yeah, there is a concern. I don't have a ton of heartburn about finishing up in April and starting back up in August in the high school age. But again, a lot of that has to do with load management and how people practice. And I've met with the High School Football Coaches Association, the leadership of that group, and I think they are really, really on top of this. And in fact, I had that question from the coaches before these calendars were released. Well, what about this? And so they're very proactive with it. And I think a lot of that is managed with how you practice. And I think we do a really, really good job in North Carolina, and have a strong cohort of coaches who understand to get their guys ready for Friday night, whether that's in March or April or next September. They got to keep them healthy on Monday, Tuesday, Wednesday, and Thursday. And I think that's the best way you do it. It's not ideal, but I also think it's reasonable for a kind of a one-off type of a situation.
Dr. Hack, one more question for you. This is from someone asking if there are additional resources elsewhere that they can get more information about mental health for their child. I know you have a slide on this, so I'll pop that up while you talk about that.
Yeah, sometimes it can be a little bit overwhelming. And what I would say is make sure you don't forget the resources that are available to you just in your community, even if they're not professionals. There's a lot of caring adults that exist in kids' lives, from coaches, school counselors, clergy, neighbors, family, friends. Sometimes it's easier for kids to talk to adults that aren't mom and dad. It's not ideal for moms and dads, but it's important not to forget that and to have ongoing relationships with those sources. And then I've got some websites up here. These are the biggies. So the Centers for Disease Control, NIMH, National Institute of Mental Health. I put the NCAA up there also because they have a lot of resources and information about how to cope with COVID. And then there's a bunch of podcasts too that it's mostly designed for collegiate athletes. It came out of Tyler Holinsky, who was the Washington State quarterback that committed suicide. His parents created Holinsky's Hope, which is a foundation to help with the awareness of mental health. And there's a series of podcasts called United. They use the 3 instead of the E because that was his number. I happen to do one of those, but a bunch of my colleagues from around the country have also done them. And they're very interesting. And I think kids could get a lot out of those. And then if you're looking for something more local, certainly families are probably going to want to go through their insurance company to see who is on their insurance company. There are other resources available as well. There's a North Carolina Psychological Association, which keeps a listing of referrals. I certainly can be a resource for families if they're looking for help and someone that might fit with them. They can certainly call me. I'm not afraid to offer that up too, to make sure that people can get to the right places.
I think we have your phone number on one of these slides too that you sent to us. So if people want to write that down, they're more than welcome to. And we will share those links that you put up here on HighSchoolOT, including Friday morning, our newsletter that goes out If people want to subscribe to that and they have not yet, you can go to highschoolot.com/email, free newsletter. You can sign up there, and we'll include all those links in that. One final question, and then we're going to wrap things up. Dr. Bloom, this one will be for you. How concerned should we be about things like lung scarring and myocarditis in athletes if they contract COVID-19? We've seen a lot of that in the news lately, especially amongst college and professional athletes.
That's a great question. I don't think we need to be as concerned as was initially reported. There's compelling data that's coming forth from the professional sports organizations that is not yet published that is far more reassuring than initially suspected. As probably everybody knows, that's ultimately what the Big Ten and the Pac-12, their concerns about myocarditis is why they didn't open their seasons initially. And what we're finding is that that risk of myocarditis is a cardiac problem. It's inflammation of the heart that can happen after COVID and other viruses. That risk, the prevalence is far less than initially initially reported. In terms of long-term lung disease, again, we haven't seen a lot of, these are for mild cases, the mild and asymptomatic cases, which is largely what we're seeing in young people. We don't have long-term data on it. So that's the bottom line. We don't have that data yet. And much of the data that was shown initially was really imaging findings, but not real strong clinical findings. So short answer is I think that, in the final analysis, that when the dust settles, those risks are going to be acceptably low. But we don't know all of the final details on that. Although what we're finding particularly from the professional sports has been very reassuring.
Well, Dr. Josh Bloom, Dr. Bradley Hack, thank you so much for joining us and taking the time tonight to answer a lot of these questions. I know it's a crazy time for everybody, lots of stress out there, especially in the high school sports world. But I think information is probably the best thing that people can get. Accurate information to help alleviate some of that. I know that's a big help. So we appreciate you taking the time to join us here on High School OT. And we hope that one day we'll get through this and not have to talk about COVID-19 ever again.
Absolutely. Thanks, Nick. Hope to see you on the sideline relatively soon. Thanks, man. Appreciate it.
Thank you. And thank you to everybody who watched here on High School OT. We will be having additional High School OT webinars in the future. Make sure you sign up for our email, highschoolot.com/email, to get alerts on those. Thanks again for watching here on High School OT. For Dr. Josh Bloom and Dr. Bradley Hack, I'm Nick Stevens. We'll see you next time here on High School OT.